Dr. Denise Sorrentino, and I am an electrophysiologist and cardiologist with the Iowa Heart Center in Ames. Everybody is different. When a patient comes in for an electrophysiology study and an ablation, we really never know what to expect. We could make predictions based on the patient's EKG or their age or other things, but a lot of the time we really don't know where the pathway is until we get in and get it started. An ablation is a procedure where wires are inserted through the veins, usually at the top of the leg. We use a mapping system or X-ray called fluoroscopy to bring those wires up into the heart, to evaluate the heart's electrical system at rest, and then intentionally to bring on an abnormal, either very rapid or slow heart rhythm that can help determine whether a patient needs a procedure called a cardiac ablation, or even we use this type of evaluation to determine if some people need pacemakers or defibrillators. When somebody comes in for an ablation, most of the time, my patients can expect to go home later that same day. When you come into the hospital, an IV is placed. Through the IV, you're given medication that is called conscious sedation, which means you're brought to a level of being very comfortable during the procedure, but you won't be completely out or unconscious. Only rarely do we use general anesthesia. Most other arrhythmias start suddenly, so someone may be doing no activity or minimal activity. Their heart rate will start racing, go from 70 beats per minute up to 200. It'll race for a period of time and then abruptly switch off. After the ablation's over, a lot of my patients may feel a skip or a flutter. You feel like, oh my gosh, I think it's going to happen again, but it won't. Cardiac ablation for arrhythmia is one of the only true curative procedures that we have in cardiac medicine. A lot of things we treat, but if somebody has a supraventricular tachycardia or a ventricular tachycardia, we very commonly can evaluate it, do an electrical study, and do an ablation. A lot of people, unfortunately, I meet and see and do ablations on, they'll tell me that they've had this for 20 or 30 years. So my main statement is, if you're having a racing heart, get it checked out. There are heart monitors that can be worn. If you have racing that lasts more than 15 minutes, you should be brought by another driver to your doctor or to an emergency room. And once the diagnosis is made, seek out options and the possibility of having it completely eliminated with an ablation.